Welcome to Healthy Births, Happy Babies, where we share tips, tools, and stories grounded in natural childbirth and parenting principles, so that instead of feeling overwhelmed and confused during this exciting time in your life, you feel safe, supported, and empowered in your childbirth and parenting journey. And now, here's your host, Dr. Jay Warren.
Hello, and welcome back to another episode of Healthy Births, Happy Babies. I'm Dr. Jay Warren. I'm the prenatal and pediatric chiropractor here at the Cap Wellness Center. And today, my guest, Kathleen Kendall-Tackett. She's a health psychologist. She's a lactation consultant, a IBCLC. She's also a very prolific author. She's co-authored numerous books, one of them being Breastfeeding Made Simple. Her co-author, Nancy Moorbacher, is going to be on the podcast later on, but today she's going to be sharing new sights into postpartum depression. Her latest edition of her book, Depression in New Mothers, has just been released, and the new research she's been able to look at shows a lot on the bad side, that postpartum depression is much more prevalent than we first thought. But then also on the upside, there are a lot of treatment alternatives, non-pharmaceutical alternative treatments that can really help. So I'm going to switch over to her conversation in just a little bit. But as always, I wanted to take a moment right now to take a word from our sponsor, the Cap Wellness Center. Hi, it's Dr. Jay, and one of the things I love about working at the Cap Wellness Center is being able to play a role in bringing a baby into the world that much more safely, much more naturally, and much more healthy. You know, it's something that is an amazing gift to give a child, to have them start off their life healthy without the stress and the trauma that can all too often be a part of the birth experience. So I consider it an honor to work with pregnant women, to help them with that time during their pregnancy. And it is a privilege to be able to work with infants and help correct any distortions that might have happened through the birth process and allow them to start off their life healthy, in alignment and in balance, so that a health challenge doesn't hold them back from being all that they can be in this world. All right, now let me introduce to you Dr. Kathleen Kendall-Tackett. Dr. Kendall-Tackett is a health psychologist and international Board Certified Lactation Consultant and the owner and editor-in-chief of Praeclarus Press, a small press specializing in women's health. She is a fellow at the American Psychological Association in Health and Trauma Psychology, past president of the APA Division of Trauma Psychology, and a member of the Board for the Advancement of Psychology and Public Interest. Dr. Kendall-Tackett specializes in women's health research, including breastfeeding, depression, trauma, and health psychology. She's authored more than 400 articles, and her most recent books include Depression in New Mothers. Their third edition has just come out, as I mentioned. Women's Mental Health Across the Lifespan, Psychology of Trauma 101, The Science of Mother-Infant Sleep, and of course, Breastfeeding Made Simple, the 7 Natural Laws for Nursing Mothers. And so now, let me turn over to my conversation with Dr. Kathleen Kendall-Tackett. All right, Kathy, welcome to the podcast.
Thank you very much. Thanks for having me.
Yeah, well, I'm excited to have you because you have quite experience in the topics we're going to be talking about today. I mean, you've written many, many different books. We heard about them in your bio. And thank you in advance for putting those out to help our listeners and help our parents get their things easier. But today we're going to be talking specifically about your newer book, Depression in New Mothers. And before we get into that topic, I just tell our listeners a little bit more about yourself. I mean, we have this amazing bio and all your experience that you have, but how did you get interested in these kind of birth and birthing type of topics?
Well, I mean, like a lot of people who are in the field, it kind of started for me with a personal experience. 26 years ago, having a baby and, having actually quite a difficult birth and not being able to find anything on it. And I was trained as a trauma researcher, and I started actually looking at some of the post-traumatic stress disorder literature and thinking, this fits. And even at the time, back in 1990, we couldn't officially call like a birth traumatic, under the PTSD definition. But, partly because of the way trauma was defined. In the PTSD definition, it was defined as an experience outside of the normal range of human experience. Birth clearly isn't.
Right.
So just right off the bat, you couldn't have talked about it. But I did talk about it actually in the first book because I kept talking to mothers about this. And this is even before, even really email, but social media, all these things that we take for granted now, and yet mother stories were still sort of circulating, and so anyway, I kind of started looking at the research literature, and, I was looking into depression, and I was really struck by what was so different in what I was hearing from the supposed experts at the time on postpartum depression and what I was actually seeing in the science, and they were not matching up. All the people were talking about, oh yeah, it's just because of this hormonal shift, and it's the big drop in estrogen and progesterone, and it's like there is like almost zero science that supports that. Now you do see a couple of studies that will say in some vulnerable women, but the way that everybody was talking about it is it was this big shift, and that's what does it, and we need to get all the mothers to wean. We're going to put them on these cocktail of medications. And I remember thinking, this isn't right. And so I said I was trained as a researcher, and so it's like I dug into the research literature, and I ended up writing a book proposal saying, look, I'd like to actually talk about what I'm seeing here. And that was actually the first edition of the book that became Depression in New Mothers. In the first edition, it was called Postpartum Depression, A Comprehensive Approach for Nurses. So with the second edition, that became Depression in New Mothers. And so now we're on Depression in New Mothers 3. So this is actually the fourth edition of the book. And it's amazing actually how far I've kind of seen the field come. But as I mentioned, I was trained as a trauma researcher. I still am actually very involved in the trauma and post-traumatic stress disorder field. And for me, that's always kind of framed a lot of the ways I've looked at this issue. Because, that was one of the things that was really striking to me. Is it's like back in the day, in the old days, everybody was talking about depression like it was this sort of random occurrence. I said, well, you've never asked, does this woman have a history of childhood abuse? Does she have a history of sexual assault? Does she have a violent partner? And they're like, no, that doesn't make any difference. Well, of course it does.
Right.
Back in the time they didn't think, birth actually made any difference. Now we actually have a lot of studies showing that. So I've seen some really big changes. One of the other things, too, is it's like as a nursing mother, this was something that just sort of developed kind of as a little sideline. I became a La Leche League leader. I started working with nursing moms. And that was always this sort of my happy little counterpart to all my depression and trauma stuff that I did. But then they started kind of meshing because the breastfeeding people started saying, gee, do you think you could come and talk to us about depression? Could you talk to us about trauma and childhood abuse and childhood sexual abuse? And so that's how those topics sort of ended up sort of, melding into each other. So again, like I said, I kind of consider myself a specialist in women's health. And so I tend to look at these things as not unrelated to each other. And one of the things that was really striking to me is, first of all, initially mothers were always told to wean. If you were depressed, you were told to wean. Mm-hmm. And I would get all these moms calling me and saying, I've just been diagnosed with depression. I've been told I have to wean, and this is the only thing that is going well for me. And I thought, wow, I became determined to find answers for those moms because I thought they're just getting passed around. And they were empowered enough to get a second opinion, right. But I knew that there were a lot of other mothers that were, being pretty much forced to wean and, were mourning that.
What was the rationale for the recommendation for them to wean?
Well, I think some of it starts with, honestly, providers who didn't have good experiences themselves. So then they say stuff like, well, you don't have to do that. You don't have to be super mom. Instead of trying to, especially if moms are having breastfeeding problems of any type, instead of addressing the problem, they just tell them to stop.
Right.
But sometimes you got moms it's actually going well, and they're still being told to stop. Well, because you need to have, one book recommends, 8.4 hours of uninterrupted sleep. It's like, and it says, well, you can pump your breast before you go to sleep, and then you have somebody do nighttime feeding. So it's like, this is clearly somebody who doesn't know anything at all about breastfeeding. You go 8.4 hours, you're going to get engorged.
Right.
It is like a physiological impossibility. And, most mothers actually don't have somebody who can sit up all night and feed the baby. The reality is we're hormonally wired to our babies. So guess who was the first one who wakes up?
Yeah.
You know, you hear that baby cry, it's going to be mom.
Mm-hmm.
You know, unless there's somebody who can actually be up and and awake and can catch that baby before mom hears. You know, so I think some of it was just a sort of lack of like connection to the breastfeeding world. I didn't think it was important. And you know, the old rationale was, well, you need to do that so you can be on medication. Well, we found that almost all the medications are compatible with breastfeeding. You know, so that argument by itself doesn't hold. So now the latest is, well, we need to do that so the moms can get more sleep. Well, one of the things we found in our study, and we actually found there's several other people have found the same thing, exclusively breastfeeding mothers get more sleep. They get better sleep. They have lower risk of depression. You know, and so it's kind of like, so these are the kinds of, sort of back and forth we kind of have with the field. But again, a lot of times it's a very strong misconception about where does breastfeeding fit into this picture. And if you think about it as being something that's just sort of trivial that you just sort of chuck off, then it's easy to do. If you see that there's some really fundamental physiological things that it does for the mother's mental and physical health, it's really unfortunate when we decide to disregard it.
Right.
And so, yeah, that's one of the things. It's like, we can really, really clearly see a big difference with exclusive breastfeeding and how much sleep the mothers get, and how that subsequently lowers her risk for depression.
In a proactive sense.
Very, very, very much so.
Right. Huh. And with the tell us more about the study that you're talking about, that you're referencing, that the size and how it's conducted.
Well, it was an online survey that we did with my collaborator Tom Hale, who's the one who wrote Medication in Mother's Milk, and it started kind of as a survey where we wanted to look at mother-infant sleep location. It's like, where were mothers and babies actually sleeping? And where were they telling their providers that they were sleeping? And one of the things I was worried about is I started hearing mothers saying, well, I'm not bed sharing, I'm going out and sleeping on the couch. And that was actually honestly scaring the absolute piss out of me, because I thought, in terms of SIDS risk, you've increased it by like 60 times, one study found.
Wow.
If you do that. So it's like, people, in order to be sort of conscientious about the never bed share advice, were doing something far more dangerous. And I remember talking to some of the people in our public health department, and they said, no, mothers aren't doing that. And so we set off to kind of actually say, okay, are they actually doing that? We really felt we needed some data. So we put together a survey, and I thought, well, as long as we're looking at sleep, we really need to really look at sleep. And so, we need to look at things that interfere with sleep, like depression, like trauma. We looked at the birth experience. So we asked, it was a very large questionnaire. It was a 253-item questionnaire. We put it up as an online link. I went around, and sort of tapped all of our network of people that we knew, said, hey, help us get moms to be in the study. We ended up getting 6,410 moms in 59 different countries.
Wow.
So we've got
huge
it's a huge sample. And it's like, we have things in the sample that nobody else has. For example, we have 994 women in our sample who have identified themselves as being, having been sexually assaulted. Nobody has a perinatal sample, of sexually assaulted women that's that big. And so it's allowed us to really do some really kind of important sort of fundamental research that a lot of people haven't been able to do. And so again, like I said, we've got such a big sample that in all of the groups, a lot of times what happens in a standard research study is, the sample size isn't very big. So that by the time you sort of divide it up into the little subgroups, then you're talking about really small numbers of women. And we've got a big enough sample that we can have 1,500 in this group and 5,000 in this group. Really big numbers. And so again, it gives us a lot of statistical power. And I think it actually kind of gets away from some of the, could it be skewed by individual differences?
Right. Well, one of the things you mentioned, and is just whether or not the typical percentages of women experiencing depression postpartum, is that true or not?
Well, that was something that was really kind of interesting that jumped out with this latest edition of the book. And what's been an interesting process for me is, as I've worked on different editions of the book over the years, and a lot of times I'm doing stuff in between, and so I come back to this research literature sort of fresh, after maybe, say, 5 years. You read a study here, a study there, but you really don't get the real picture until you sort of dive in and read hundreds of the studies, kind of at the same time. I always kind of feel like you have to come at it with fresh eyes when you do that. And, every time there's been stuff that's been different. And one of the things that really jumped out to me this time is, the statistic we always quote about new mothers. We say 10 to 15% of new mothers are depressed. Well, I've said for years, and in fact, I said it in the last edition of the book, I said, I think that number's too low. I think at a sort of bare minimum, we need to be saying probably 15 to 25% of new mothers. But what really struck me this time is the number of studies that were done with populations that are of higher risk. Like say populations where there's history of abuse and adversity. They're finally starting to look at that. Where, maybe they've had a previous perinatal loss, where the mothers have been through a natural disaster, where they're immigrants and asylum-seeking women, where they have violent partners. I mean, these are unfortunate realities in so many of the mothers' lives. And, these are not the mothers that are coming into the surveillance of the people who say 10 to 15%. They're just not. And so when you start looking at those higher risk samples, it is as high as 60% in some of those studies.
Wow.
And what that kind of said to me is, I think, we've been kind of looking at the one little chunk, but we're not looking at the much bigger picture. And I think in some ways we have to almost like rethink about our sort of models of depression, because that 10 to 15%, I think, reflects the women that come to the attention of the mental health community. And it's like when you go to like a conference like that and you look around and everybody looks the same and you say, well, these are the mothers that we're seeing. But it's like they're missing this whole other sort of picture, of mothers who are not coming into that system. And unfortunately, those are the mothers I think that oftentimes will never get the assistance that they need, because, even sometimes if they're identified, the comment I hear over and over and over again is, we have seen this, we've identified these mothers, and they're telling us they can't get in to see anybody for 6 months. And 6 months is an eternity for a new mother.
Yes.
Yeah, and so it's, again, like I said, I really think we need to be thinking about, what else can we do? And so I really think it's going to change some of the ways we think about depression. The more I reflected on that, I thought, I think in some ways I've actually been calling 10 to 15% a statistic of privilege. I think honestly that's what it is, because I think it's missing this other huge piece. And so again, I think we need to really sort of rethink about depression. And I think the thing that tells us too is how common this is. We sort of act like it's this sort of like thing that happens to just a tiny percentage of the population, when in fact it's a much larger problem than we've thought about before. And, that's, I think, what we really kind of need to sort of wrap our heads around.
Right. And it's not only these groups that, might be identified but don't have access to mental health services for various reasons, but all of the underreporting, women that are, first couple months and having a horrible time but are behind closed doors. And so much what we try to do here at the Cap Wellness Center is create community, whether it's like Mama and Me classes or the breastfeeding support group. So, women can, be out, meet other women, and also be supported if they're needing help. But there's so many that just are behind closed doors. So if there's someone listening that might be, kind of going through that experience right now, or might be knowing of someone in their lives that might be at risk, like what are the kind of things that a person should look for that would prompt them to get some more help, rather than it just being just a normal part of being a new mom?
Well, I would say a couple things. One of the things that's come up in the sleep research, which I think is actually really interesting, is looking at how depression changes sleep. And it's like a lot of times with new moms, everybody thinks, okay, well, if mom's not sleeping very well, it's because of the baby. Well, you know what? Chances are, if she's depressed, she's not going to be sleeping well anyway. Mm-hmm. And one of the signs that that has come up in study after study after study, and it's amazing how consistent it is number of minutes it takes to get to sleep. And we're finding 20 minutes to get to sleep is okay, 20 minutes and under. But 25 minutes and above, that's a high risk for depression. And so it's kind of like, if that is a consistent issue. Now, I've had, one of my friends said, well, does that mean like the time you're laying in bed reading a book? No. That means you're actually trying to go to sleep, and it's taking you that long. Because a lot of times that can actually indicate that there's something going on. Now, everybody has the periodic nights when they kind of sort of can't shut down. But if that's kind of a habitual thing, or like you're up in the middle of the night and you're writing thank you notes, or you're doing step aerobics or something like that. When everybody else is sleeping, these would be definitely red flags for me. the kind of obvious ones, like feeling like nothing is fun, nothing is pleasurable, you just don't enjoy things. Feeling really fatigued all the time. Now that, oftentimes can be something of getting poor sleep. Postpartum is tough, and then having depression on top of it, that just compounds all those, those awful feelings. If you're feeling like, like you're crying a lot, everybody has, postpartum again is tough, so sometimes it's just good to have kind of a release. But if it feels like it's all the time, or it's like every single day, those would be things I would definitely look at. One thing that actually you might find helpful is on my Praeclarus Press website, we've got actually a little screening tool up there, and it's under the white paper section, but it's postpartum depression at a glance, and it's got 2 quick little questionnaires, and that actually can tell you. They're ones that that they use like in medical settings and stuff, but they're ones that you can easily do yourself and score. And so that'll kind of give you an idea. If you're worried, or if you're worried about somebody that those can be kind of quick little things that say, maybe we need to take a closer look at this.
Right, because that is something like working with so many women postpartum. There's certain cases that are kind of full blown. Where like, okay, yeah, this is an issue. Let's get you some help. And then there's all those other gray areas of, well, there's tons of stuff to do. Of course, I'm up in the middle of the night getting stuff done.
Exactly.
And then it brings up, okay, well, you need more support, but maybe that's not depression or falling asleep. I find a lot of women are very anxious. Rather than them describing it as depression, they're describing it as being anxious. Can you tell us more about that?
That's very common. Well, and there's quite a bit of overlap between this sort of anxiety disorders and depression. So I kind of use depression as a more sort of generic term. I mean, a lot of people kind of prefer the term PMADs, postpartum mood and anxiety disorders. Mm-hmm. I'm kind of getting away from that myself because post-traumatic stress disorder is not included in that. PTSD for me is a big part of this sort of picture. But yes, anxiety disorders, anxiety symptoms, very much can be part of that. And in fact, the short version of the Edinburgh Postnatal Depression Scale, which I have actually on that, screening tool that I told you about, the 3-item of that is actually a more accurate measure than the full 10-item. And the reason it is because it taps those anxiety questions.
Okay.
Yeah. So yes, there's definitely a lot of overlap. And the interesting thing is, they're different diagnoses, but the treatment a lot of times is the same.
Okay.
So it does kind of make you think, is there something that's sort of like an underlying physical thing, and then you have all these various little, sort of outbreaks, depression in one woman, anxiety in another, but there's kind of this underlying, sort of similar thing that's going on, etiology that's going on underneath the surface of all of those.
What does that treatment typically look like?
Well, it depends on which way you want to go. And it sounds like at your center, which sounds absolutely fabulous, by the way, you aim for kind of a more holistic kind of treatment.
Yeah.
The nice thing is, one of the things I talk a lot about are some of the non-pharmacological treatments for depression. And there's a whole range of them. Probably one of my favorite ones to recommend is exercise. Mm-hmm. We found actually it started with 2 different studies that came out of Duke University Medical Center. They put exercise head-to-head with Zoloft for major depression and found that exercise was as effective.
Wow. That's a great
and then
study.
now there's been, a nice Cochrane review that came out in 2013 showed the same thing. So exercise is a very, very potent treatment for depression. That's one. Omega-3 fatty acids. Most women are short on those. I would definitely recommend those. I would actually recommend those, honestly, as a prevention. Mm-hmm. So making sure you've got enough DHA. The minimum that they recommend is 200 milligrams. I personally think we're going to actually see that the recommended minimum eventually goes up. Mm-hmm. Because when you look at women who, in countries where they eat a lot of fish, which incidentally also have low rates of depression, the amount of omega-3 that, or especially DHA, that they get from their diet is 800 to 1,000 milligrams.
Oh, wow. A lot more than the minimum.
A lot more than the minimum. Yeah, I would say 200 is the bare minimum, but actually, honestly, it's probably high. For treating depression, 1,000 milligrams of EPA. Okay, so that's not 1,000 milligrams of fish oil. That's, look on the label and see how much EPA is in it.
Right.
In terms of safe brands, the U.S. Pharmacopoeia has verified 2 brands that are very inexpensive, Nature Made and also the Kirkland Signature brand from Costco. Both of those have been verified by the USP. So, you can actually go to, usp.org, and it actually tells you, these things. And incidentally, I have no commercial connection to either brand. But they what that does is that means they're tested for contaminants.
Okay.
And so I feel safe, recommending those brands. And, because, you can go with the pharmaceutical grade, but a lot of times for a lot of women, they're too expensive.
Right.
So it's nice to know there's, over-the-counter brands that actually will kind of get the job done. Right. The other thing, bright light, you live in an area where there's lots of natural bright light. For people who live in other parts of the country where that's not true, using bright light therapy has actually been, shown to be actually quite effective for depression. I'm trying to think what else. Acupuncture, people are having, some very good luck with acupuncture. We've got some nice clinical trials, especially looking at acupuncture in pregnancy for depression. St. John's wort, some of the safety data about pregnancy is a little bit iffy. That probably wouldn't be where I'd go, but, definitely very high efficacy for treating it postpartum, and it's safe for breastfeeding. Incidentally, all these treatments work. And we also know antidepressants. Antidepressants work. Now, the interesting thing about all these treatments is that every single one of them, as an underlying mechanism, they lower inflammation. They all do it in different ways, but they all do it. Psychotherapy, the two things that really seem to be very helpful, cognitive behavioral therapy, but also interpersonal psychotherapy. That seems to actually be almost eclipsing cognitive therapy in terms of, postpartum depression. It's amazing how many studies we're getting on that now. Wow. But even stuff like social support lowers inflammation. Things like massage lowers inflammation because it activates that oxytocin system. Right. So that's the sort of anti-stress system. So you got that system upregulated. You find that actually the stress system goes down, including the inflammatory response. So that's kind of the underlying physical mechanism for that.
Right.
But yeah, all of these, there's all these different treatments, have really good clinical basis.
Fantastic. Well, in our last couple moments here, tell our listeners how they can, learn more about you, get your book. Where's the best place for them to reach out?
Well, a couple different places. My Kathleen Kendall-Tackett Facebook page, that's where I tend to post a lot of the stuff that kind of comes across my desk on a daily basis. But also, if you go to my publishing company, Praeclarus Press, which is spelled Praeclarus Press. I sort of violated the first rule of small business. Don't name something that people can't pronounce or spell.
Right.
But if you go actually to KathleenKendall-Tackett.com, there's a link to it as well. You'll see that. But so there's a link to that. It's on Amazon. If you type in my name on Amazon, we also have it on Praeclarus Press. So It's available in all those different places. I also have on both Breastfeeding Made Simple and Kathleen Kendall-Tackett handouts for mothers with different alternative treatments for depression. I said, we're constantly putting new stuff up. That would be a place to look as well. So I would either say, Amazon, Praeclarus Press, or Kathleen Kendall-Tackett would be a good place to start. Okay. Again, like I said, I'm also on social media. So.
Great. And I'll have links for all of you listening there in the show notes, as well as on the webpage that you might be listening to this as well, just so you don't have to try and spell out Praeclarus Press.
Yes. Sorry about that.
No, that's okay. And just have all those links. I'll have a link to the screening tools for the depression as well, the things that you mentioned, so everybody can get that information. With the last moment, what's the major take home that you'd like a listener listening to this, or about something we talked about, or maybe even something we haven't mentioned that you'd like them to take home from our discussion today?
Well, I would say, you do not have to just keep toughing this out. Depression is common. It's treatable. There's a certain logic to it. I mean, we know what kind of causes it, and there's no shame in this. It is so important for your well-being. You are so worth it, to be treated for this. And it doesn't necessarily mean you have to be on medications. There's lots and lots of different self-help things you can do. There's lots of sort of natural things you can do. So the nice thing is you have a whole range of possible things to do. But I would say, please do something, because, it's just, misery to be depressed. And so it's like, if you can do something about it, please do, because it really is going to benefit you. It's going to benefit your whole family. So sometimes mothers think, oh gosh, I don't want to take the time. It's like, this is something that's going to help everybody. It's going to help you. It's going to help your partner. It's going to help your child. So this is going to be a good thing. So that's what I'd say. This is treatable. You are worth it. And, it's not your fault. It's very predictable why people get depressed, and we can do something about it, and so that's a good thing.
Good. And what about for the little babies that might be listening? I always like asking that question to my guests. If the mom's listening to this with the baby on their chest, or maybe they haven't met the baby yet that's prenatally, what's one little pearl of wisdom or message you'd like to whisper to them?
I would say, you are loved.
Yeah.
And you are perfect. And go to sleep.
Go to sleep. Right. Which is a whole other topic of how do we get these little ones to sleep? Yes. I love that, Kathy.
But I think actually, again, like I said, babies are so great. But yeah, sometimes that sort of transition, sort of from womb to world, can be pretty rocky. And it's like, that's the thing to keep remembering. Like, this baby is going to be so worth it. And you're worth it. And we're just going to kind of get you through this patch.
Yeah. I mean, the parents listening to this, they're already so engaged, wanting to do so much to be good parents and to welcome this little one into the world, and any help they can get to make that transition easier. Not easy, but easier.
Easier. And, we're in a culture that does not support new mothers, and that's a whole nother topic as well. But
yeah.
Yes. And so, I mean, that's the thing. Our moms think that they just need to just jump in and do everything. And it's like, if there's one thing I would kind of suggest is, I have a handout called how other cultures prevent postpartum depression. Take a look at that. Find out what other cultures are actually doing, because I think you're going to see how far from the mark we really fall. And why it's important to take that time. And no, you don't have to get up and be perfect and fit back into your jeans immediately, and just take that time, because you know what? When you look back over sort of a whole history of your life, this is a pretty short time, and it's worth it for you to just be in it and be present in it.
Very wise, very wise. Well, Kathy, thank you again for taking the time to share wisdom. Listeners, please reach out and get that book, get the different tools that she mentioned there. And if you are feeling like you need some help, find some help, whether that's, with your pediatrician, with your OB, with your friends, through us, however it is. Just make sure you get that help so you can enjoy the first part of parenting, rather than it being a challenge and a problem.
And I'd like to also mention, too, Postpartum Support International, and their website is postpartum.net. So that they also, too, have, clinicians and stuff in all the states, that they can make referrals.
Okay, great. I'll make sure that's included as well. Well, thank you again, Kathy.
Well, thanks for having me.
Thank you for joining us today. For more information about this episode and other natural childbirth and parenting topics, please visit us at capwellnesscenter.com or message us on our Facebook page with any questions you might have. We here at the Cap Wellness Center look forward to helping you and your family be as happy and healthy as you can be.